At 26, I started experiencing some, just completely out of the blue, some very odd symptoms. I had double vision only in my right eye, and I had a subtle paralysis on the right side of my face. Really odd symptoms to be experiencing completely out of the blue. After some time trying to go through my primary channels of my primary doctor, who they referred me to, and getting no answers, my parents thought it'd be a good idea for me to go to Mayo Clinic, which, living in Florida, we decided to go to the Jacksonville campus. And that I did. 1991, went to Mayo, presented there for, I think it was 2 days of diagnostics. Met with the neurology team, neuro-ophthalmology team, and internal medicine. So after a brain MRI, lumbar puncture, lots of blood work, a couple days later, meet with the neurologist, and he shares with me that it is his best guess that what I have is demyelinating disease. However, there was very minimal evidence in the way diagnostically, and all my symptoms, by the time I got to Mayo, which was several months later, all my symptoms had abated. So his recommendation was, and I read, my diagnostic suspicion is that Miss Fox may have demyelinating disease. The possibility, from a therapeutic standpoint, I really do not feel any specific treatment is indicated at this time. Symptomatically, Ms. Fox's course has been one of improvement. I would encourage her to begin to increase her overall level of physical activity in a gradual fashion. Certainly, should there be any other specific changes in her neurologic status, further investigation may be warranted. So, with that, I went on to live my best life. Well, I did some research based on what the doctor told me, and I thought, well, if this is a possibility, I want to figure out what I can do. So I did a bunch of research. I just ended up getting my hands on this book, The Swank Diet. There's a Dr. Swank, and he had done some studies that I consider that made a lot of sense to me. He found that diet influenced MS symptoms dramatically with a group of patients. So I read through it, considered it, thought it made sense for me, stayed on this very low hydrogenated fat diet, only 15 grams of saturated fat per day. Probably did that for about a year or so, but even beyond that, even when I wasn't strictly on that diet, which I didn't continue it, past about, I think, a year and a half, I had always and just continued maintaining a very healthy diet, and I was always very active. So that was what happened then. And then what I did was every 3 years, I would go get a brain MRI. I, according to where I was living, go to neurology, get set up with a neurologist and be followed. I figured it's a good idea. Let's make sure nothing ends up happening. So every 3 years, got an MRI. Every single time I got the MRI, came back with one of three possibilities. Migraines, could be MS, could be vasculitis, a vascular situation. So every single time, every 3 years, I'd get a brain MRI. And so that was that. And so from there, the story takes a little bit of a few turns.